Bilateral Xanthelasma. Xanthelasma palpebrarum is more common in women, occurs 1.8 times more often than in men and occurs in about 2.5% of women and 1% of men. Large, foaming, fat-laden histiocytes, the so-called Xanthoma cells, penetrate diffusely into the dermis and cause inflammation of the skin. The typical clinical appearance is asymptomatic and consists of an orange or yellowish papule on the outside of the skin. In some cases, a yellow plaque forms on the upper eyelid, and in some similar cases, all four eyelids are affected. The soft yellow plaques affect the four eyes in this and similar cases. The disease can also spread to people with other diseases such as diabetes, high blood pressure, heart disease, or diabetes mellitus. It should be remembered that blinking can also spread to other parts of the body, milking the lipid, a rich intermediate fluid at the midline. The lesions typically occur in the upper eyelids, especially in the inner and outer corona. The disease appears to be more common in people with high blood pressure and diabetes mellitus, as well as in the elderly. Bilateral Xanthelasma and bilateral eyelid xanthomas. A bilateral xanthelasma of the palpative apparatus, which affects the entire upper and lower eyelids and resembles a pair of circles, is very rare. In this context, there are reports of some cases of xanthelasmas that develop only on the non-paralyzed side of stroke victims or potential stroke victims. A 53-year-old woman came to the hospital with severe eye pain and severe redness of her upper eyelid. The lesion started at the bottom of the woman's upper eyelid and spread to the side, and then appeared in the middle of her upper eye and the lower eye. It was not painful or tender to the touch, but it was easily visible and therefore caused cosmetic concerns. The patient complained that she felt harassed and that opening her eyelids felt a bit heavy, worried about the cosmetic appearance. She also reported that the upper eyelid had been cut previously and she felt harassed by it. Examination of bilateral xanthelasma. In physical examination, with bilateral meaning two matching plaques, the yellowish flat lesions affect both the upper and lower eyelids, which resemble a pair of circles. The lesions on the sides of the lower eye, while the other sides are linear or curved. In physical examinations, the median lesions on both sides and both upper eyelids were commonly particularly large, with the largest lesions occurring on the upper and lower sides. The lower eyelid is located at the junction of the lower cornea with the sclera, and there is a normal resting position for the upper eyelid. This would explain the proliferation of the bilateral xanthelasma. Xanthelasma is a yellowish papule or plaque caused by the deposit of lipids on the eyelids. Although the most common cause of eyelid retraction is thyroid ophthalmopathy, xanthelasma, due to the excess pressure placed on such a delicate area, can itself start to cause ongoing issues with the actual eyelid of an individual. These lesions have been associated with hypothyroidism, cirrhosis, and nephrotic syndrome. About 50% of patients with xanthelasma have abnormal cholesterol and triglyceride levels. The fat deposits in xanthelasma consist of foaming histiocytes containing fatty acids such as triglycerides, lipoproteins, cholesterol, glucose, sodium, potassium, calcium, magnesium, iron, phosphorus, zinc, copper, and sodium chloride. This is the reasoning behind making sure that you get checked over by a doctor to ascertain the health of your internal body system. When it comes to actually removing the xanthelasma plaques, then Xanthel is the widely suggested treatment, due to the treatment being affordable, in comparison to any other alternatives, and after a single treatment with Xanthel, the plaques don't return. Explore more about Xanthelasma and how to remove them at xanthelasmatreatment.com or xanthel.com.